Hi, I'm Dr. Sunny Patel, a third-year neonatology fellow at Vidant Medical Center affiliated with East Carolina University. The purpose of this video is to help educate those involved in neonatal care on the importance of neonatal hypertension. I'll be sharing some simple standardized guidelines you can use to help assure that blood pressures are being measured appropriately to better understand the true prevalence of neonatal hypertension. As uncommon as neonatal hypertension is, it does warrant early recognition and treatment because severe untreated hypertension is associated with target organ damage, including retinopathy, encephalopathy, left ventricular hypertrophy, and cardiomyopathy, increasing your overall mortality. Despite these risks, we still do not have standardized guidelines to ensure we are obtaining accurate measurements. Currently, elevated blood pressure in neonates are often detected by routine monitoring of vital signs, and clinicians are often unsure of how to interpret these routinely measured blood pressures for diagnostic purposes. We know that when gold standard calibrated intra-arterial catheters are unavailable, obtaining a non-invasive blood pressure measurement can be challenging in this unique population. I'll mention some straightforward techniques which should be used at all times when applicable to help ensure that we are obtaining accurate blood pressure measurements. With more accurate blood pressure measurements, we can aim to identify those patients who need further diagnostic evaluation and help identify the true prevalence of neonatal hypertension. So let's get into the 6 standardized blood pressure measurement techniques. When obtaining routine vital signs as per your NICU guidelines, which for most neonatal intensive care units, it is every 6 hours, factors which play a role in altering your blood pressure measurements include the cuff size, the extremity in which the blood pressure is measured, leaving the infant undisturbed, the state of the infant, either asleep or awake, the positioning of the infant, and if the blood pressure measurement is taken before or after a feed. First and foremost, we will need to obtain the correct blood pressure cuff for the infant. Based on the limb circumference, blood pressure cuffs are to be selected per manufacturer guidelines, such as Philips, GE, and Welch Allyn. There should be 4 to 5 blood pressure cuffs from each manufacturer, which are relatively similar in size, to select from. As you can see, the blood pressure cuffs are labeled Neo 1 to Neo 4 based on the increasing size. Each cuff has a range labeled in centimeters for the desired arm circumference. Blood pressures should be taken preferably in the right upper arm. When high blood pressure is noted in one arm, undertake blood pressure with the same instrument in the other arm and lower limb for confirmation. When the concern arises for neonatal hypertension, for the purpose of identifying consistent elevated blood pressures, the measurement should be taken 3 times, 2 minutes apart, every 6 hours for a total of 12 blood pressures over a 24-hour period. Let's tie both of these together with a demonstration of how to obtain the accurate cuff size in the upper right extremity. So we'll start with our measuring tape. Identify the right upper extremity, and we'll go ahead and measure the arm circumference. And as we can see, the arm circumference is approximately 5 centimeters. When we come over to our cuff sizes, we can see that Neo 1 ranges from 3.4 to 6.3 centimeters. So this is our cuff of choice. Now that we have identified the correct arm circumference and appropriate cuff size, we can obtain an accurate blood pressure. Studies have shown that the next 4 techniques mentioned have helped with obtaining accurate blood pressure measurements. Obtain a blood pressure in either supine or prone position. After placing the cuff, the infant should be left undisturbed for 15 minutes prior to inflating the cuff. giving them time to calm down, obtain the blood pressure while the infant is asleep or in a quiet state, and lastly, when possible, obtain blood pressures at least an hour and a half after a feed or medical intervention. I hope this video has given you a better understanding on how to accurately obtain a blood pressure in the neonatal population to help identify those who need further diagnostic evaluation. Thanks for watching.